If you've got people that you've decided need to come off these drugs and they're physically dependent, you're going to have your hands full, because weaning off these drugs is really hard. Because when they're weaning off, they're in withdrawal, and when they're in withdrawal, their pain goes up. We see that. Our withdrawal lasts about a week to 10 days in an inpatient basis, and they get a lot of support. I mean, if you have them in your practice and you're doing it over 4 to 6 weeks, it's really hard work. People do that sometimes, wean. It's really hard work. I think that's one of the things you're up against.
Well, in this area too, we're in Fallon, but we have people come to our center all the time. We'll send them to us for detox. We're happy to take your patients. But I tell you what, trying to get somebody into a detox center in under 6 to 8 weeks is almost impossible.
Treatment availability, we talked about that with the judges, and the judicial system is a big problem. No question about it. I don't know what the answer to that is. You know, your patients come in, they say, what's the difference between being addicted to painkillers and just really, really liking them a lot? I had a patient who came in and said, I don't have addiction, I have dyslexia. The bottle said take 1 every 4 hours, I took 4 every 1 hour. So, denial. Addiction, simple definition, is compulsive use. So compulsive use is if you know compulsion, if you have not looked at your BlackBerry or your iPhone since we started, I know compulsion. I want to know who wants to get in touch with me. There was a little beep. That's compulsion. It's also compulsion to take the drug in the face of illogic. Loss of control, taking more than intended. And that can just be taking one and not remembering if I took, I took a Soma and a Lortab, and did I actually take that drug? I can't remember. I better take it because it's time. Continued use despite harm. Harm to body, Tylenol, the acetaminophen in hydrocodone preparations and the like. And then the last is craving in the absence of the drug. And for people with chronic pain, the craving is pain. So unless we deal with the emotional aspects of the pain, we're going to be in trouble when we take them off their drug. So this is a tall order. With addiction, there are lots of consequences. Sid Savage is a pain addiction specialist. Sleep disturbance, physical problems, depression, anxiety, stresses, functional disability, and substance abuse. This is the system of chronic pain. It's exactly the same. And if you have both conditions, one drives the other. So people's substance use revolves around their physical problems, which cause more depression, which cause more physical disability, which exacerbates the sleep disturbance, which exacerbates the addiction. Substance dependence diagnosis is complicated. The best standard we have now is the DSM-4, and it's a terrible standard. It's 3 out of 7 characteristics. The first 2 are tolerance and physical dependence. We just said everybody on opiates gets tolerant and physical dependent. And the next 5 have to do with preoccupation, tendency to lose control, and 2 around continued use despite consequences. So it's hard to diagnose this. It's challenging to diagnose it. We can look at aberrant behaviors, but we can't really diagnose addiction. We can worry, and we can be suspicious, and we can deal with drug use. But definitive diagnosis is tough in the presence of chronic pain. I mentioned the 4 kinds of patients, so I'm not going to go over those again. And the last is that this is a dopaminergic brain disease. Addiction is a disease of the reward system. There's a new definition of addiction from American Society of Addiction Medicine. Nucleus accumbens, ventral tegmental area are more susceptible to the effects of opioids. And here's where the opioid receptors are. They're all over the brain. The cognitive centers of the brain, loaded in the midbrain, in the reward center, in the thalamus, which is good, in the spinal column, good, but when we give somebody an opioid, all these receptors get filled up. And certain people are more vulnerable to others to taking these drugs.